Okay, it's 4:10. We're ready to start our, first interview for the, for board appointments. And I think at 4:10, we have Mr. John Ham for the, library board. You doing all right tonight, Mr. Ham?
I'm doing well, how about you?
Good.
Good.
Want to thank you so much for coming out tonight.
Well, it's my honor to be here to speak to you all tonight, share my thoughts, wishes, and hopes.
Okay, all right. All right.
Can you show us your library card so we can
I
confirm?
have any bill folder if I do. I'll be glad to show you. I don't go anywhere without it, just like my American Express.
Is there one of the old ones like mine where you would, it's orange with a metal clip in it?
I have one with
I have
ours
that
with the metal clip, I sure do. I have it upgraded though.
Okay.
I've got the newer version of it.
Okay, all right, Mr. Ham, so tell us a little bit, for the ones that don't know you, I think everybody pretty much knows you, so just tell us a little bit about yourself.
I
You
feel
can
like
start-
most of you know me, but I'll give my biography here.
Okay,
I'm John Ham, a lifelong resident of Silicaca. Been here for 68 years, a few months, so I'm thrilled to be here to speak to you all tonight. And on behalf of the library board and the staff at the library, I want to appreciate everything that you all do for us financially, because we couldn't operate the library that we have without fine ladies and gentlemen like you all. We try to be very good stewards of the public money that you all entrust us with, and I think we do a lot to give back to the city as far as the investment that's made into the community and to the citizens of Silicaca. We do get a majority of our funding from you all, and like I said, we are very appreciative, and I'm very proud of the library that we have and the staff. We are involved in a lot of different things. I've made this statement before. Library is not just about books. It's about from the children's programs to the senior citizens programs and all ages in between. We serve every facet of the community. We just had a dedication of a new children's story time room over there. If you've ever seen those children playing and having fun and they're getting read to by Ms. Cantrell, it's a sight to see. We also have the senior program, which is the Brown Bag Adult Series, which we currently have going on right now this month. I think if you all take a little time to come see the programs on Wednesday, you'll enjoy them. They're a lot of fun. Sometimes they're musical, sometimes they're comedic, sometimes they're serious, but they're always a good program. And we also have our outreach program, where some of the staff goes to the senior citizens centers and takes books to them in nursing homes and some of the retirement communities. We have a weekly television program that you all probably have seen on the early morning program, where we have a lot of educational and cultural experiences. And as one of the longer serving members of the library board, I believe that we have one of the best boards that you all have provided to us to help us provide what the community needs and wants. And I think we, along with the staff, put a good product out there. I think there's a good return on the city's investment in the funding that we get, and we're very appreciative of that. We also are moving forward with our technology. We're doing a lot of digitization right now with the Avondale Sons, the Tommy Bibbin Avondale Sun collection. We're putting those on, digitizing those so that they can be accessed from the public. You've probably seen on the bulletin on the TV over there, you've seen the pictures, and they want us to identify the individuals who are in there. So we're trying to get all that done so that the public will have access to that. We're also digitizing newspapers, photographs, and a lot of important documents that the public can see. One of the other advances in technology that we've got going on, being able to take some of these old reel-to-reel videos that we had 30 years ago, at least familiar with a lot of 40 years ago of things that happened, and you can take them and convert them over to modern technology today. So we've been very fortunate to be able to have the technology to be able to do that. So, very proud of the library. I hope you are equally as proud of it as I am. And anything you all need, want us to try to make it even better, we'll certainly listen to everybody's comments and thoughts.
Okay, so hearing you say all that, Mr. Ham, tell me, why are you interested in continuing to serve?
Well, it's like I spoke just a moment ago, the technology that's out there now, I'd like to see us take that up to a further step so that gets completed. We're a long way away, and I'd like to see that project completed.
Okay, so, as a current board member, what strengths or perspectives would you, say you bring to the board?
Well, I've got many years of public accounting experience, and brings a financial background to helping with the budgets and the finances, and helping, I don't help Tracy much, but when she asks for some help, I can give her a little advice on the financials. I also have 8 years as former city clerk back from 1988 to 1995. And then in 1995, I went to work with SoCog Utility Board as the chief financial officer. So I have extensive knowledge of municipal finances and been involved with this city for 33 plus years. So I love this city, and it's home.
Okay, so what priorities do you believe should guide library funding and resource decisions?
Library funding, well, we as I said earlier, we're very appreciative to you all what you provide to us. It handles our salaries and our day-to-day operations. Anything above and beyond that, we go out and seek grants. We have an LSTA grant, which is a library grant. We get several grants from Dollar General, from the Comer Foundation. And there's quite a few that we go out and seek that funding to get additional revenues, so that we have a stake in this. It's not just the money that y'all give us. We go out and get additional funds so that we can do some things that goes outside the scope of day-to-day operations. We try to handle all of that ourselves in-house without having to come back and ask for additional funding. So.
Okay, so let me ask you, I have one more question. I don't know if they have any.
Okay.
So what do you see the library's most important role in the community is today?
I think it's the fact that we have the capability of touching every single age group in this city, from, like I said earlier, from the young ones to the elderly, to the infirmed, the school system that we are involved with. So I think that's our primary role, is to be here to provide what the community needs. We have what we call virtual library assistant, who will sit down one-on-one with people who are not they don't have the technology with us.
Like me?
No, ma'am, not you. They don't have the computer skills or the technology, so they can come over there and get a one-on-one lesson. So it's
I might need to take one of those myself.
but we can certainly make that happen. We can certainly make that happen.
Well, that's all I have, and I mean, I'm actually a liaison to the library, and I can say personally, I do appreciate everything you guys
We
and
appreciate
the
it.
current board does for the city and for Tracy, so the city is very appreciative and proud of the library.
As we are of you all, we couldn't do it without the support that y'all give us.
Thank you.
Madam President, may I ask a question?
Go ahead.
Mr. Ham, tell me an example of how your CFO experience helps the board or helps the library.
Well, like I said, from my accounting and financial background, it helps with budgeting. You know, somebody's got to figure out where the money's coming from and where it's going. And I've been very involved with Tracy in doing a lot of things with the budget, as well as with the utility board and the city here in previous years. So budgeting is probably the biggest thing, and controlling costs is
Yeah.
probably the next thing.
Thank you, Mr. John.
You're welcome.
No questions from me.
Patrick?
I had one, we talk a lot about the streets, which the library has a lot. I don't really see many weaknesses at all of the library, in my personal opinion, but if there was one area that you think the library could improve on in your tenure, what might that be?
I go back to the technology side of it. That's, without the additional advancements in technology, we're gonna get behind. And I think Tracy's doing an excellent job in getting us down that road, to getting us to the level that we need to be.
Thank you.
All right, well, I think that's it, Mr. Ham. And I forgot, Laura did tell me that she's gonna be running late, so I do apologize for her not being here. I should have said that at the beginning.
If she has any questions, I'll be,
You know she'll reach out if she has any.
I've got my number.
Thank you, Mr.
Thanks.
Ham.
See you, Mr. John.
Thank y'all, I appreciate it.
All right, so next on the list is Diana Thornton for the same, position, library board. You doing all right tonight, Diana? Good. So we're gonna go on and, get kicked off tonight by asking you to tell us a little bit about yourself, start, personally, and then go into your professional background.
Oh, okay. I am originally from Douglasville, Georgia. Moved over here 16 years ago. I married a guy over here. Been here ever since. And we have a church here, so I'm deeply involved in the church. And, got kids, grandkids, great kids, and I'm family oriented. And I like to be involved in things. And, I was, in financing for about 25 years, manager at finance companies in different locations. I was in Billerica, Georgia, for 18 years over there. Then I was in security finance here in Columbus finance. So I've had that experience, managing and everything. I was a custodian for about 15 years, I think it was. It's been a while ago, but I think that's how long it's been with Cobb County Board of Education over in Marietta, Georgia.
Okay, sounds like you're about like me, you've had a lot of jobs, and I didn't even, realize you had a background in finance until I think, what was it, about a week ago, Nate? I mean, you probably found out together.
Oh, really?
So, yeah, we found a fun fact out about you about a week or so ago, so that was interesting.
Yeah.
All right, so let me ask you this, so what is your interest in serving on the library board? What made you decide to want to serve on the library board?
I want to learn more about things. I love learning, and I love to be involved in things. And I'm not gonna sit here and say that I've ever been on the board or anything, because I haven't. But I like to learn, and I like to see what's going on. And I like, my main thing is to being involved in something. I'm retired,
Okay,
so, I have time.
okay. So let me ask you this, what strengths or perspectives would you bring, to the board if selected?
If selected and, there was things that needed to be done, I would firmly, push for it. If it's what it really needs to be, that we could do and everything. I wouldn't just, put it aside and say, whatever. I would try to do what I could.
Okay, so, let me ask you this, what priorities do you believe should guide the library funding and resource decisions?
I'm sorry, what?
So what priorities do you, believe should guide the library funding and resource decisions?
I'm not up to date on that, so.
So let me ask it this way. Let me ask it this way, so what do you think the priorities of the library should be? Maybe I should ask it that way.
The priorities
Of the library.
would be the, funding and, people and doing things for the people, getting people to come in there to see things. I've heard a lot about Sylacauga, about things that was here,
Mhm.
but I've never seen anything, what, Gomer Pyle, I think, was born here,
Mhm.
but I've never seen nothing.
Okay, we're gonna have to get you over there to that museum with Miss Judy then. She's gonna love to have you over there, so get ready. She's probably got a lot of stories to tell about that. So, my last question is, what do you see as the library's most important role that it plays in the community? I know you said you really haven't been as much involved, but I'm pretty sure you did some research since you wanna serve in the library. So what do you think the library's most important role as far as the community would be?
It's for, everybody coming in, getting the books, being there, having assistance there. If you need something, somebody's there to tell you where to go and where, you can find it at.
So basically just serving the people, like customer service.
Serving the people. I love serving people. I love people.
Okay, all right, that's all my questions,
How will your financing capabilities help the board?
If there's, like the funds, the, donations, anything like that, I'm pretty sure I can, work with that, because like I said, I had to run a office, I had to pay bills, I had to go by budget, everything like that, so I think I would have a lot of input. I'm not really up to date, because I've been retired for, 8 years now, so I'm not really up to date the way things are nowadays, but I'm willing to learn, and I do know a lot about finance. I used to have to go to court too, let me tell you that I did have to go to court and fight for the company, for their money.
Ashley. Okay. All right, well, do you have any questions for us? I didn't even ask Mr. Ham that, so you're getting treated special tonight.
Oh, no, I don't think I have any
All right,
questions.
well, that's
I just
it.
appreciate you giving me a chance.
Next two.
Well, thank you so much for, your interest. So we got you down for, a couple other things. So I guess we're gonna ask the same questions. So you also applied for the, historical commission. And I know, I will say this too, I just got, news, we do have you on the agenda to go ahead and appoint, but there was another applicant. So we are gonna have to wait before we appoint this, seat until we interview her.
Okay.
So this appointment won't happen until, what is it, in 2 weeks?
21st.
The 21st.
Okay.
So we won't be doing any appointment tonight for this one. I'm so
Okay.
sorry.
That's okay.
Her application got left out. All right, so I have some questions, so just tell me, you've already told us a little bit about you personally and professionally. So why, what are your interests in serving on the, historical commission?
Historical.
Mhm.
Because, when I was out talking to people, they had pointed out some, and I don't know, I'm just going by what they said, some historical places here that has grown up. It looks like everybody falling in and all, and that got me interested in how many more is around here, what can be done for them.
Okay, all right. So let me ask you this, and it's kind of just the same thing as the library. So if selected, what do you see, as a commissioner's most important role would be as serving on the, historic commission?
To try to give the historical things back like it was, to serve the people and get the people's ideas on it. And just, I just fell in love with it when they told me at that one place over there was historical, and I was like, really, why is this like this?
Well, that leads into my next question, then you're gonna love this one. So how would you approach a conversation with a homeowner concerned about the cost of restrictions of preserving a historic property? So say somebody, because a lot of times it is expensive to restore these
Yeah.
properties. So how would you handle a situation when somebody's telling you they don't feel that we should put that much money in something just because we think it's historic?
Well, I would find out what it represented and what they thought of it and what they were planning on doing with it, and just go into it easy, that you could probably fix it up and you could have people to come in and see, and just things like that, because, to me, historical, you go in, you can go, that's the best thing that you can go do is look at the historical stuff, and I would ease into it with them. I wouldn't just say, well, what, the money and all that and everything. I would just talk to them about it, see what the background is on it.
And just try to help them see the
Yeah, and
importance
just
of
go from there,
restoring it. Okay, that makes sense. I think that's a pretty good approach. Alright, so one more thing from me. So what unique strengths or perspectives would you bring to the commission if selected?
I would bring the, hope and, prayers and everything that we could do, the things that we wanna do and push it to get it done, you know? I
Yeah.
mean, work with people. Like I said, I love people and I love working with people and I love talking.
So kind of just bring some of that history back and educate people on what it actually means.
Exactly, I mean,
Okay.
you know, you could talk to one person, they could tell you the whole history on this, but then you talk to somebody else, and, you know, I mean, like I said, that about, you know, Beaumont Powell, I guess that's a historical thing here, and I didn't know their house was up, 2 or 3 houses up from me.
Yeah, just making sure people are educated on the history.
Yeah.
Okay, alright. Well, that's all I have. You guys have any more questions?
No, ma'am.
I usually take over. I'm sorry, Miss Diane. I just
This
take over.
is true. You like the interview now.
Thank you, so, alright, so we're gonna finish that one. So we have one more. You also applied for the, healthcare authority, right?
Me, yeah?
Yes. Come on back, come on down. Alright, so again, so what is your interest in serving on the healthcare authority?
Okay, when I first moved over here, and I was out of a job, I went to work for the health department. I was only there for 3 months before I went to, security finance. I was a CNA. I got to helping people, knowing people, and I loved it. I loved doing that.
So do you have any experience in healthcare? I guess some of your stuff is kind of public service or working with any boards. Would this time, if selected, would this be your first time serving on a board anywhere, no matter where you live? Okay.
Anywhere.
So do you have any experience in the healthcare field?
Just that 3 months is it, if you wanna call that healthcare. As CNA, like I said, I would go out to,
I think that's some experience.
you know, but it was only, you know, like I said, 3 months, because my thing was finance. I wanted to get into the finance and back into it after I left over Georgia, because that was my main thing that I had done all these years, the past years.
Okay, you keep giving me my next question. Thank you, Diana. All right, how should a small-town healthcare system balance financial, sustainability with the need to provide accessible care? Because I think we all know there's like, a healthcare crisis and some people can't, afford it, but I mean, a hospital also can't operate without any funding. So how do you think, in a small town, the healthcare system should balance their financial, sustainability?
Oh, well, let's see. That's really, I'm not sure.
That's okay.
On that, because like I said, I never.
You just have to get in there and just
3
see.
months, and, you know, that was all I done.
That's okay. So let me ask you this, what do you think the biggest healthcare challenges facing small communities like ours is?
I think it's the elderly. They are just, they're having a hard time. I was just in contact with a lady yesterday, she's in her 80s. And she sent me a message and she said, maybe I'll have $50 left out of my check. You know, this woman's probably fixing to go through chemo and all of that, and it's sad. I mean, something needs to be for somebody that can be helped like that.
So again, my next question, you just keep doing it. So how would you ensure the voices of all community members, including underserved or vulnerable populations, are considered in board decisions? So how would you make sure the voices of the underserved are heard?
I would make sure, I would tell them, I mean, get out there and walk and talk to people. I learned whenever I was out there walking, there's so many nice people out here. I met so many people that, and a lot of them has trouble, and a lot of them would like to see things done and everything, but, it gets to me to see these elderly people that cannot do anything because they're having to pay for medical help, prescriptions, and to see things that, I don't know a whole lot about it because this is Alabama. In Georgia over there, the doctors would take and write a letter and give it to the person, and they had a place they could take that to get to their their medicine and stuff like that, and I thought that was fantastic.
Oh, wow. You want to tell us a little bit more about that?
Right, and I thought that was really, because, you know, you would think every time anybody walked into the office, they would tell them, but they didn't, and that's what I couldn't understand about it. Why not tell all of them? Why just pick and choose and tell them? But I think there's lots of resources out there that can be found, and, whenever you meet them, you know, and you talk to them and you find out the situation you're in, at least give them hope that you can do something.
Okay, all right. Well, that was all the questions I have. Do you guys have any?
I'm good.
All right. Okay, well, thank you so much, for your interest in to serve on all these boards, Diana. But just remember, for the Historical Commission, we will not be making a decision on that one tonight. We have to do one more interview.
Okay.
All right?
Thank you.
Thank you.
Thank you.
All right, we're right on time. See, Dr. Bowman is already here. You ready, Dr. Bowman, or you want your extra 4 minutes? Well, come on down. You doing all right tonight, Dr. Bowman?
Doing well, doing well.
How's retirement?
That's right.
All right, so, just gonna start all the interviews the same, so I think just about all of us know you, but for the ones that don't, will you tell us a little bit about yourself, just, personally, then go into your professional background?
Okay. Well, graduated from high school in Silicaca, went to Auburn, got a degree in pharmacy, worked at a few drugstores, went back, got a PhD in pharmacology, and then went to medical school from there. And finished medical school and residency, practicing in Silicaca for 40 years.
So you've done your entire practice in Silicaca?
Pardon?
You've done your entire practice in Silicaca?
Yes, other than part-time stuff.
Okay, I didn't know that, okay. So, we all know that you are, a doctor, so let me ask this, I'm trying to figure out the way to, answer it. So how do you think your experience plays a part in you serving on the healthcare authority?
Well, I think it's important to have physician representation on the healthcare board.
Okay.
For input, the chief of staff is also an ex officio member, but a lot of times they have clinical reasons and they can't make all the meetings. Always able to attend. I just think it's good to have physician input on the hospital.
All right. How do you think a small town, healthcare system should balance financial sustainability with the need to provide accessible care?
Well, it's a job we work at every day, and there's 24 hospitals that are in deep trouble in Alabama. But our hospital is fairly strong, and it's a small hospital, but it's in the top 67% in the state as far as population, and beds. And, we're always seeking new sources of revenue. We got the wellness center, got the wound center. We're adding beds for psychiatric patients, and maybe we can get some of this money from federal government that's coming down through Alabama.
I know, we hope so. Hopefully we all can get some of it.
That's right.
What do you think the biggest healthcare challenges facing small communities like ours is?
Well, it's financial, and right now, we're in the lowest per diem reimbursement for Medicare and Medicaid, but based on location.
I think we all, found that out this year just by attending some of you guys' board meeting, because we didn't actually know how that worked until we were actually able to just see it on paper. So it was eye-opening. It was really eye-opening, just to see how that stuff actually worked.
You know, some places, with a higher standard of living, they get 3 times as much as we.
Wow, wow. Alright, so my last question is, how would you ensure the voices of all community members, including underserved or vulnerable populations, are considered in board decisions?
Well, you know, the emergency room does about $12 million a year worth of free care. 'Cause they don't turn anybody away. And we always try to see everybody that needs help. Then we worry about the finances later. But it's still a problem, but
I don't think many people, understand how fortunate we are to have the hospital, especially like you said, since they don't turn anybody away. I don't have any more questions.
I'm good.
Appreciate
Good to see you, Doc.
I
yes,
don't
sir.
know, Laura.
Good to see
I
all
don't
of
have any, I was over his resume. It's
Okay.
very impressive resume, by the way, Doc.
you. Yes, ma'am.
All right, well, that's it, Dr. Bowen, and thank you for, coming out and your willingness to continue to serve.
Okay, well, we appreciate all the work you guys do.
Thank you.
Thank
All right, we have one more candidate, it's, Cedric DeBarnleben, and we're running early, so Cedric, you want your extra 9 minutes, you coming on down. All right, so how you doing tonight, Cedric?
I'm great.
So, all right, I know you recently just ran for office, so some of us got to, know you a little bit better. So, but for the ones that don't, why don't you start off by telling us about yourself, personally, and then go into your professional background.
Okay, great. So I'm Cedric DeBarnleben. I am a long-term resident of Sylacauga. I've lived here all my life. I went to school here. Then after school here, I went to college in Georgia. Finished school in Georgia, majoring in medical building coding with a minor in health information technology. And I have been in the healthcare industry ever since on a lot of different avenues of healthcare. Professionally, I have worked on the billing side of healthcare. I've also worked on the clinical side of healthcare as well. I used to work for medical billing offices, and I used to do ancillary services, our credentialed ancillary services to the network for 3 states, Santa Rosa, which is Panama City, Alabama, and Tennessee. And I worked in the hospitals as a phlebotomist on the clinical side, and then I became a liaison there. And I segued out, got on the board of directors for a healthcare advisory firm that is based in Chicago. It's HEW Healthcare Solutions. So I've been sitting on their board since 2010. And so we do a lot of things with different public sector. We've partnered with 30 plus public and national sectors as a nationally recognized organization. And so healthcare has been my little thing for a while.
Okay, all right, thank you for that. So let me ask you this, so why are you interested in serving on the Healthcare Authority?
I'm interested in serving on the Healthcare Authority because I love healthcare. I dig deep in healthcare. Also, we live in a small town, and a small town of where healthcare is, basically, I say, because our hospital, like you said, does not turn anyone around. We have to look into different sectors for our hospitals and for our organizations that fall under the Healthcare Authority Board to bring in more money, to bring in more revenue, to be able to continue to see those people and not have to have anything come out of our pocket. We have to look at the finances, checks and balances of the organization as a whole to make sure that budgeting is correct, so we can continue doing the work that we have been doing in our community that a lot of people don't see and don't even know about.
Okay, all right. So, in here, you did say you had some experience in healthcare, and, so let me ask you this, so your experience in healthcare, how would you say it played a part on the public service side, and what do you think your experience, like, I'm trying to figure out how to say this, what could your experience bring to the board?
My experience would bring to the board within our city a more empowering public engagement, as well as seeking PFE for programs for family engagement within our city, and great partnerships. I think our partnerships as liaisons, which I consider board members to be, because you're the middle person in between the organization and what goes on. I think those partnerships of great city engagement for on a city level as well as a national level will be something that I can bring great into the organization. I work with ATWE, go to the White House about 6 times a year to work on a lot of these healthcare laws and bylaws that come down the pipeline. So I sit in about 6 sessions a year working on all those things and on a national level. And I think it would be, I would be a great influence to bring those things back into our city to help us try to elevate and to be able to grow our city and grow our organization.
Okay, so how should a small town healthcare system balance financial sustainability with the need to provide accessible care?
I would first say partnership. We need to work on our partnerships. We have to bring in more revenue. We have to figure out ways that we can, strategic ways to bring in more revenue, because you just bringing it in any type of ways is not really good. But we have to bring in strategic ways to bring in more revenue to our organization and to our city to help balance out those, the things, like we said, where we're giving the free healthcare, we need to bring in those grants, we need to look at all the funding and bring in as much money as we can to the organization so it can continue to grow, as well as, continuing on with safety improvement, health safety and health improvement for the organization.
Okay, what do you think the biggest healthcare challenges facing a small community like ours is?
I think we face a lot of challenges when you live in a small community because everybody's so used to everything being done fast and when they want it, how they want it. So we have to educate our people who are uneducated and unlearned on how the systems work, how the organization works, what can be taken from the organization, when we get funding, where the money goes, how it's dispersed, and how it's used. So that way our city, as well as our other constituents of the city and on the board, know how the check and balances are rolled out, how the organization is gonna continue to keep doctors on staff, with continue to give free health care. All those things are big things for us to help our people understand.
Okay, so how would you ensure the voices of all community members, including underserved or vulnerable populations, are considered in board decisions?
Those things, we have to have resources. Anybody that, regular constituents and constituents that are underserved, we have to have resources. We have to be able to provide the resources that our people need. So sitting on the board would be a great thing to learn of the current resources we have, but also try to find new resources for all of our citizens. Because we have so many people that live in our city that are actually ex-military that don't have the everyday life that some of us have. And it's just because they don't have the resources. They don't have the proper resources, they don't have the people and the family to take care of them, to provide them with those resources. And sitting on the board could be a simple, me seeing you in a grocery store and we having a conversation about your dad who's a military vet and who can't get this, and because I know the resource, it will help our community. Also, having public community engagements, maybe every quarter, we go somewhere and bring in the citizens and talk to them about the resources that we have that are available to everybody in the city. And that way they can become learned about what we have, what's available to them as constituents in the city.
I think that's a good idea. Okay, so I don't have any more questions. Do you guys have any questions?
No, ma'am.
It's great.
No, ma'am? All right, so you have any questions for us?
No, I don't have a question.
All right, well, thank you so much,
Thank you.
Cedric,
Thank
for
you.
coming out and your willingness to want to serve on the Healthcare Authority.
No, thank you.
Thank you.